Hey, my name is Dr. Cozy. I am the physician who's going to be treating you today. And looking at your paperwork, we have you here because you got a pretty good bump on the head, yeah? Okay, really quick. I need to do a quick test with my light, okay? So do your best to keep your eyes open. Focus right here in between my eyebrows. And how are you after having that light in your eyes? Did that make the headache worse? Okay. Can you point to me where the headache is that you're feeling the most? You're not sure. Okay, that's fine. Adrenaline can make things a little bit muddled. That's normal. Can you rate your pain level for me on a scale of 1 to 10? 1 being like a paper cut, 10 being excruciating, like you're gonna pass out. Okay. Can you verify for me your name and date of birth? Do you know what year it is? Okay. And do you know where you are? Those are standard questions just to establish your level of cognition. Can you tell me what happened? Oof, I'm sorry. Okay. Was there any bleeding? Okay, I'll take a look in a few moments here. Did you lose consciousness at all? Okay. Any moments of confusion, like perhaps you didn't know where you were, you didn't remember what had happened? Any nausea or vomiting? How about any ringing in your ears, hearing loss? Are you having pain anywhere else? Did you hit anywhere else? Okay. Well, I think that's the extent of my questions for the moment. Let's take a look at you. First thing I want to do is a quick coordination test. I want to make sure that your brain is okay. We need to rule out a type of traumatic brain injury. I'm going to be moving my finger in different areas. I want you to reach with your index finger and tap mine, okay? Are you having a little bit of difficulty seeing? You think you're seeing double? Okay. I'm going to do a couple more tests really quickly here, okay? So this one is going to look like I'm going to poke you in the eye, promise you that I won't, but I want to check your blink reflex, okay? So... Oh, I'm sorry. Okay, so we're struggling a little bit here. Okay. So, do you see the cap to my pen right here? I'm going to move this in a few different directions, and I'd like you to do your best to track with your eyes where this moves. So follow the tip of my pen. Do not turn your head. Just look with your eyes, okay? Try to keep focusing on it. It's going to move closer to you. I'm gonna move back. I have this handheld chart here, okay? Are you able to read for me any letters on here? So I'm noticing something called convergence insufficiency, which is when your eyes are struggling to track and focus together. They're having a hard time working as a team. So what we can do in a moment is try some vision therapy. Just a moment. To see if that helps. We'll try some vision therapy in just a moment. First though, I need to rule out the presence of any other injuries. So to begin with, I would like to check your scalp and look for bleeding in anywhere. Find the area where you did hit and check the level of swelling, okay? Is that okay with you? I promise you I'm going to be as gentle as I can. Just going to stand up over you. If anything is painful, please let me know. So, I'm going to feel my hands here. Not seeing anything in the scalp. Other than the area that you noted, that I definitely felt. Go ahead to feel your neck now, okay? Any pain, tightness that you're feeling here? Just the usual, okay. I'm not feeling anything either. I'm gonna take a quick peek in your ears if that's okay. Next, I'm gonna start on this side. Okay, that's okay. Okay. If anything is uncomfortable at all, let me know, okay? Because that's good information for me. I'm not seeing any kind of get you to open for me. Beautiful. I'm just going to press down on your tongue. Open your mouth one more time. If you can lift your tongue for me. Okay. You can relax. And okay. Now I just want to take a quick listen to your chest. I apologize if this is a little bit cold. Can I get you to take a deep breath in for me? And out. Good. Again, deep breath in. And out. Again. And one more. Good. And you can just breathe normally. I'm just going to listen to your tummy. Okay. Everything sounds good. I'm just going to be pressing on a few different areas of your tummy. Let me know if there's any tenderness anywhere. Okay. So, your physical exam is intact. I'm not seeing anything remarkable other than that lump on your head. So now what I'd like to do with you is some vision therapy. And while we're doing it, I'm also going to be doing a neurological assessment as well, just to rule out some severe neurological symptoms that could indicate a concussion or something more serious. But they kind of go together. So, okay, a few moments ago, I had you follow the cap of my pen, just using your eyes, alright? So we're going to do that again, only this time I'm going to be moving it closer and further away from you. So I want you to focus right here. Okay. Okay. Let's try that again, but covering your right eye. Okay. All right. And then let's switch. And now uncover both. Okay. Continue tracking. You can take a break for just a moment. Are your eyes feeling strained at all? Are you feeling like a headache is emerging from that? No more than you are already feeling? Okay. Okay. So now I want you to focus on my finger. Okay. Focus on my finger. Focus. And again, did that cause a sensation of any eye strain, any new headache? Okay. So I have my fingers right here. I want you to track the one that moves. Okay. And again, pain, strain. Tip of this cotton bud. It's considerably thinner than my finger, okay? So first, covering your right eye again. Just want you to follow it. Okay. Now switching. Yep. Now open both eyes and track together. Okay, getting better. Relax your eyes for just a moment. Okay, so I'm going to use the needle of the syringe. It's quite small. And don't worry, it's not going to make any physical contact with you. I just want you using only your right eye at first, so cover your left, to track the movement of the very tip here. So okay, switch eyes. And then open both eyes, track together. Keep your eyes focused right here. Do not look away from the tip. Try this again with the point of my needle here, and don't worry, again, it's not going to make contact. So it seems like you are doing okay when the object is farther away from you, but when the object gets close is when it becomes difficult to focus. Would you agree with that? Okay. aspect here. Let's have you close your eyes, okay? So let me know when you feel my cotton bud touch you and where you feel it. Okay. Okay. Yep. Good. Yes. Okay. Okay. You can open your eyes. So now you're going to feel me squeezing your shoulders, and I want you to tell me when you feel me let go. So. Good. Good. Yep. Good. What does it smell like to you? Alcohol, yes. And this? Yes. Vinegar. And this one? Yes, menthol. Good. Lemon, yes. Okay. Now I'm going to test your hearing. So if you don't mind closing your eyes again for me, please. Thank you. Okay. I just want you to tell me which side you hear my fingers fluttering, okay? Good. Good. Mm-hmm. Okay. Good. Good. Yes. Good. Okay. You may open your eyes. Okay. Right. So now I'd like you to tell me which is closer, my finger or my light. Okay. Finger, light. Finger, light. Light, finger. Light, finger. Tricky, yeah. What color pens do I have? Okay. Are these two the same color or different? How about these two? And these two. Are these the same color or different? How about these two? These two? out of these three, which one is pink? Which one is orange? And which one is red? Of these three, which one is blue? Which one is green? And which one is purple? Good, okay. So it looks like the only symptom that you're having at this time is the diplopia, which is the double vision. I'm not seeing any kind of neurological deficits on exam, which is good. But that being said, I do think that the double vision is a result of a concussion. So to begin with, I'd like you to follow the concussion protocol that we have here for our patients at this hospital. For about 3 days at least, I would like you to do your best to just let your brain rest. And you can do this by avoiding screens for a while, so really limiting the time you use your phone, avoiding watching TV, playing video games, and also outside of screens to limit your time doing things like reading where you really have to focus and concentrate. Although to be fair, if you're having diplopia, it's going to be difficult to do anyway. And this includes also some physical rest, which means which means abstaining from exercise or any kind of physical activity that's really going to tire you out. After 3 days, slowly introducing these things back in, which means starting with like a little walk, going for about 1/4 mile, and each day trying to increase the distance just a little bit. In terms of exercising your brain, starting with reading maybe a chapter of a book, and then when that starts to feel more comfortable, slowly reintroducing screens, okay? And another thing would be to avoid things like saunas or taking a hot bath, just because that can also have a harmful effect on us when we're in this state. It's also very important that you keep yourself hydrated. Hydration always plays a big role in healing. And of course you can use analgesics as needed, like Tylenol, acetaminophen. Okay? I do think that giving your brain some time to rest will help and resolve the double vision that you're experiencing. But just in case, I am going to give you a referral for an optometrist who is specialized in vision therapy, so that way if you are continuing to experience this, you can have somebody to work with to resolve this issue, okay? Okay, so just a moment here. So now if your symptoms increase, you start feeling more pain or any kind of new symptoms develop, I want you to come back in here so we can reevaluate you and make sure that everything is okay. Okay? Okay. So then I would like to keep you here at least for the next hour for observation, just to make sure that no acute symptoms arise that haven't presented themselves yet. Sometimes things can have a delayed reaction because we have endorphins that kick in after any kind of serious injury. So if that is the case, I want you here so that way we are able to address it immediately and get you taken care of properly. Okay? So on the remote control for the TV, there's a call button. It's kind of shaped like a little person raising their hand. If anything starts to feel weird, press that button and a nurse will come in immediately. I am going to have one of my nurses checking in here every 5 to 10 minutes to make sure that you are staying stable and that no new symptoms have appeared. Okay? Okay. And then before you go, one of our nurses will come in with instructions upon discharge of the protocol that I spoke to you about just a few moments ago, as well as a list of doctors with whom you can see to follow up for vision therapy should the diplopia persist. So, okay. Do you have any questions for me? Okay. Well, if you need anything, push that button. And also, if you do start to feel nauseated, oops, let me get the alcohol wipes out of here. I do have this basin right here. If you're not able to make it to the bathroom, feel free to use this, okay? That's what it's for. And I'm gonna go pass along some information to my nurses and let them know to come in and check on you, okay? Okay. It was really nice meeting you, and I hope everything starts feeling better really soon.